Welcome back to the show. Many thanks for staying with us. Well, there's some good news out there for sickle cell patients because government, together with other allied health partners, have signed a memorandum of understanding with global medicines company Novartis to create a new public-private partnership designed to improve the diagnosis and accelerate treatment for people with sickle cell. We know that in Ghana, it's estimated about 15,000 babies are born with sickle cell every year. This intervention seeks to bring some form of relief to those who have the condition. I've been joined in the studio by two strong men. They're going to talk to us about it. I have Dr. Kweku Ohene-Frimpong. He's the president of Sickle Cell Foundation of Ghana. Doctor, you're welcome.
Thank you very much.
And I also have in the studio Dr. Patrice Machaba. He's Group Head, Novartis Global Health and Corporate Responsibility. I just said Dr. Novartis.
Thank you.
Dr. Machaba, you're welcome as well. So this memorandum of understanding, I mean, which of you wants to break it down for us to know exactly how it works? How is it going to work for the benefit of the public or the sickle cell public? Which of you wants to go?
I think I'll speak from the Ghana
Please,
side, and Dr. Machaba will speak about the commitment of Novartis.
Okay.
So as you know, sickle cell disease is a global disease, but about 80% of people born with the disease are actually born in sub-Saharan Africa. Okay. The disease originated from here and spread around the world. But this is the place where the problem exists, but we have not been able to take advantage of some of the new developments in making the lives of people with this disease better. There are new treatments along the way that we are not even able to take advantage of because we don't have well-developed research programs. So we appealed to Novartis, the largest drug company in the world, to see whether they will help us. And in small ways, they were helping us, but in a major way in 2018, Novartis decided first to make sickle cell disease a very important program for them to develop in sub-Saharan Africa, and luckily they chose Ghana to start the program. So we discussed with them some of our needs, and in broad terms,
what are these
we
needs?
have developed guidelines for managing sickle cell disease in Ghana that they helped us develop. They need to go through some field testing so we can teach doctors and nurses in Ghana on how to manage this disease. Secondly, as you know, we started screening newborns for sickle cell disease many years ago, but still it's only in the Kumasi area because government hasn't been able to support the national scale-up of this program. And that's why we asked for help with it. In order to do newborn screening on a national level, we have to establish more sickle cell centers where these babies that are diagnosed can go for care. So part of the initiative is to develop more sickle cell centers, and Novartis has committed to develop a center of excellence for sickle cell disease in each of the regional capitals for us. And then the screening will spread following that. But for much more immediate use, there's a drug, it's an old drug that has found great use in sickle cell disease in the last 25 years. It's called hydroxyurea. It is really changing the lives of people with sickle cell disease.
What exactly does it do?
What it does is that it enables the body to make a healthy hemoglobin, the baby hemoglobin that we all make during pregnancy. It doesn't have sickle cell disease in it, and then when we are born, we switch from making that hemoglobin to the adult hemoglobin. The sickle cell problem is in the adult hemoglobin, but people who make more baby hemoglobin in addition to the adult hemoglobin, their disease is mild, and if the baby hemoglobin is high, then sometimes you can have no symptoms of the disease at all. This medicine makes it possible for the body to make more of this fetal baby hemoglobin, so that people with disease now have a much healthier blood and they don't get as sick and don't get many of the symptoms.
So you will still have the condition, but the symptoms will be...
It doesn't cure the condition, but it's something you take daily. And Novartis, what they've done for us is to make the drug.
Let me go to the Novartis mind and have him speak to it, Dr. Machaba. So continue from where he left
Thank you
off
for the
as far as how
welcome,
Novartis
Kiki,
coming.
This is my third visit to Ghana.
I'm sure you're having fun.
We're having fun.
Relax, just relax and have fun.
But I want to first thank His Excellency. It all started with a discussion we had with Prof. Koff and His Excellency last year Our CEO came to visit His Excellency, and we talked about this program. We're an old company, more than 150 years old. We are present in 150 countries.
Okay.
I myself was born in Zimbabwe and practiced in South Africa, but I've been doing drug development in Switzerland and in the US for 20 years. And when we saw the great work that was being done in Ghana in terms of starting with newborn screening, we said we can help.
Okay.
Because we know now that if all babies are screened, and we're only screening about 2 to 4% of the 15,000 babies that are born with sickle cell, and if we put them on ordinary penicillin and hydroxyurea, that they can actually live a healthy life.
Okay.
At the same time, so we're going to help make sure that there's universal screening.
So first of all, in terms of the benefits, in terms of how this benefits the people in Ghana who have sickle cell, is that as much as possible you're examining a lot more babies to be sure that from the beginning we know.
Absolutely. Here's what we know. If you don't get screened and if the baby is carrying the gene and they don't get access to penicillin or hydroxyurea, they don't live a normal life.
Okay.
By a simple screening of all babies and giving them that medicine, then they live a normal life.
Okay.
But what we've committed to, because one of the biggest obstacles was the price of hydroxyurea, to make it available at a price that is so affordable that in the end it should be included in the national health insurance.
Oh wow, well that would be great.
Yes.
Is that happening for sure, or is this still at the negotiation table?
This is part of the memorandum. The first consignment of hydroxyurea arrived this month.
Okay.
A larger consignment is arriving in September.
Okay.
More importantly, we keep reimagining and trying to discover new medicines for sickle cell.
Okay, well, what I wanted to establish before you go on, Dr. Machawa, is whether or not this has been sealed, I mean done for real, as in the drug being on the national health insurance. So
the Director General of Ghana Health Service has committed to that. His Excellency, the President has committed to that. The Honorable Minister has committed to that.
Okay.
And we've brought in the consignment to make it available.
So can you confirm, is this something that you can confirm that we will have it on the national health insurance? That would be great.
We hope that by the end of the year it would be. So for now we have a consignment that will be about half price compared to what's on the market that many people cannot afford. Okay. And then we are intensifying the activity led by the Director General
of the Ghana Health
with the National Health Insurance to make sure
so from
we
how
hope
much,
that by the end of the
from how much to how much?
Maybe I can make a comment on that. We expect, so initially the numbers obviously will be small. Ghana has to be congratulated. They're the first country to do this. It's a unique partnership. As we extend to the rest of Africa, we expect the price to drop anything between 60 to 80%.
Okay.
And make it available.
Okay, can you give me the specific amount involved in this so people who have the condition, for example, will know, so they have an idea?
So Prof, maybe you can comment on the current price, on the current market.
The current price is about $28 to $32 a month. It's a medicine you take every day.
Every day, wow.
Right. And what we're being offered now is about 15, so it's about half the current price.
So hopefully as we go along,
we'll bring the price down.
I think this will be tremendous, and the fact that we can screen children from the beginning so we know, and then they can be on that, you know, be on the drugs that stabilizes them. I think that's perfect. I'll take very quick final words from you because
I just wanted to add, by developing those centers of excellence, it's important that Ghana becomes the leader in Africa in clinical trial research. There are new medicines that are coming for sickle cell. We will bring those new medicines here for clinical trials. So Prof and the other excellent doctors that we met can do those studies here and make those medicines available. Okay. The time is past where patients should be going to the US or Europe for new medicines.
But our politicians go to US and Europe. We the poor people stay behind. Well, that'll be good. That'll be good. And we hope that the politicians will still stay behind. And when they get these processes and they get these systems in place, that they will stay here as well, because they know that the system is great enough. But Doc, thank you very much. You have any quick final words on that?
Is that yesterday and today, we have the first team of doctors, nurses, and pharmacists at a workshop right now at Accra City Hotel being trained on how to use this medicine. Wow. And so in about a month, they will be out there, hopefully beginning treating a larger number of patients than we've ever done before. Wow. So we're excited.
Wow, this is impressive. And I know that I'm sure my viewers, some of my viewers have the condition, but this is good news for you. So people should rest assured that this consignment that has come will be spread across, and that there'll be the accessibility as well, yes, for a lower price than we've had it.
Yes.
I wish that we had some more time so we can go on and on about this, but I think if it's crisp enough, it's good enough. Yes. Thank you very much for coming. Dr. Kweku Ohene-Frimpong is the president of Sickle Cell Foundation Ghana. You can Google them, look them up anywhere you find them, information about them on the internet, and if you want to do any follow-ups, please take your time and do so. Also here in the studio is Dr. Patrice Machaba, his group head for Novartis Global Health and Corporate Responsibility. We've been talking sickle, so thank you once again for coming.
Thank you so much. Thank you for having us.